Okay, EMT 52. I just finished a workout. We're sitting by the pool and kids are getting some lunch. And I figured I'd make a video to help explain a couple of things. A couple of things I've been thinking about as I worked out today. One of them being, a lot of you mentioned fascia when you talked about compartment syndrome in your discussion boards this week, and it's a very fascinating topic to me. I personally have delved into a little bit about fascia and have really attempted to get my fascia to be as healthy as possible. Most people aren't even aware they have fascia or what fascia is. So fascia, it's that fibrous connective tissue type stuff that attaches your muscles to each other and creates compartments within your limbs and in your abdominal cavity. And it also is what's holding your skin to the muscles itself. So just below the skin is where a lot of fascia resides. And there are theories, there are thoughts that the fascia from our entire body is all connected to each other. So I'm not sure how much I feel about if it's all really literally connected, but I do feel that if your fascias mess up in one spot, it's going to affect a fascia in another spot, especially if you've got fascia that's messed up in your feet. It may impact the way that you walk, therefore affecting the fascia in maybe your hips or your back. So I can see how the link is there. I don't know if it's literally or if it's just a compensatory thing. But many people have marketed lots of tools to relax this fascia. The thought is that this fascia is kind of like a netting, like a fishnet stocking. If you ever have deboned thighs or you've made some chicken thighs and the skin, like you got the thigh meat and then you got the skin, that tissue between it, that web-like tissue between it, that's fascia. And so it's supposed to be kind of like a fishnet stocking, horizontal and vertical in a very strict pattern. Sometimes the fascia gets kind of tangled up like it would like a hair, like when your hair gets all tangled up in the back. Those of you who have hair in the back. So it almost gets like knotted up. And that's where the term knot comes from. You can massage someone's back and you feel all those really rough bumps along their back, and those are knots, they're fascia. So the fascia is all tangled up in that area. So people have marketed lots of tools to be able to release this fascia. There's myofascial release type. Physical therapists will use myofascial release to kind of help with some of the muscle pain that people experience. So I have dealt with fascia problems for a while now, and so I've pretty much invested it, I feel, for every gimmick. And some of them work better than others, so I figured I'd just kind of show you the fascia tools that they have out there that help release this fascia, in case you guys are wondering, like, why is my back so sore? Recently, I've been using a lot of, I've been on my computer a lot, and I have a small tablet that I use for school, that I use for everything. It's my life. And so I'm hunched over at my desk, I'm hunched over in my bed, I'm hunched over at the table working on this stuff all the time. And so, it does not contribute, my poor posture does not help the problem, I guess. And so the bad posture contributes to pain. And so I have a lot of pain that I experience in my upper back between my scapula. I'm watching my kid because she's getting a little ballsy there. Rhea, no. She thinks that she can swim and she does not know how. So the scapula, the muscles that hold it all to the spine in that area is really, really painful for me. So it's where the trapezius attaches to the spinous processes of your vertebra. Below that level, you've got your rhomboid muscles and your levator scapula muscle that kind of comes up. So those muscles are all always very tight for me. And you got a lot of tendons that are attaching everything. And then you got fascia on top of that. And so they can all get really, really tense, really tight. Those muscles, if they're weak and you work them out too much, they start to spasm. And spasming muscles are just these muscles that are just super tight all the time, and you just feel very tight all the time. And so how do you relax that? How do you work the fascia out? Here's some tools. This one, I'm not sure what it's really called. I've seen it called a Theracane before, and there's some peanut butter and jelly on it. Rhea is playing with it. So this here, the shape of it here, if you can see, you're able to get behind here and just really massage any areas that are really, really, really tough. And so that works really good for the back. There's been quite a few marketed tools that it's called a fascia blaster. This thing here, this is a doozy. This one here, these little claws that you see on here, you rub it on your skin. So on the forearm, you rub it back and forth in a really straight up and down pattern or horizontal pattern to work out the fascia, to make it straight as that fishnet is supposed to be, and not in a tangle like your hair. So it's basically combing out your fascia with this. It's super intense. You can go super deep in with this. You can get every single muscle of your body, I mean your feet even. They even have special fascia massagers just for your feet, for people who suffer with plantar fasciitis like myself. Plantar fasciitis is the fascia on the bottom of your foot. And if you ever get out of bed and you're just, those first couple of steps are just, terrible pain, those first couple of steps until you kind of loosen everything up. Your fascia on your foot might be inflamed. It's called plantar fasciitis. And so they've got this little doodad here that you stick under your foot and you roll it around. It's supposed to massage that fascia out. So it's actually kind of quite painful for myself. I don't ever use this. My kids think it's a ball for them to play with. That's her ball. Hi, Mama. Another thing here I got is this doodad here. This is designed to go between those areas that's bothering me. You take it up against a wall and you roll up and down the wall. You can roll up and down on the ground. If you need to lay on the ground to do it, you can do that too. But it's designed to help really, really deep massage that fascia. And then you've got these fascia rollers, this type of thing here that you lay on, and you can get your big muscles like your glutes, your quads. Runners use this a lot to help with their legs. So that's one thing I was thinking about. So many of you mentioned compartment syndrome, and my fascia. My fascia. My back is just absolutely bothering me so bad today. So a lot of you mentioned compartment syndrome and how the fascia connects everything together, and how because the fascia is so non-forgivable, I guess, non-pliable, there's not a whole lot of room for swelling. Blood flow is constricted, and so when the muscles get swollen, it can wreak havoc, and then people have lost their limbs. I just got sprayed by my pool. Okay, so I thought I'd tell a quick story about a person with fascia issues. So I was working at CRMC in the neuro unit. I worked in a stroke unit, and so I got a report from the ER nurse saying the patient was found down, stroke-like symptoms. They thought that maybe he was hypoglycemic because he's a diabetic, was working in his garage. And basically he fell, and they weren't sure they thought it was a stroke. So they brought him to the stroke unit that I worked on. And so and they said that there was minor abrasions to his leg. So as soon as I saw him, I knew something was catastrophically wrong with this patient. I didn't know if it was a stroke or not, but it was not presenting like a stroke. Yes, the man did have some paralysis of his right side. His right arm and his right leg specifically were paralyzed. He did not have any facial, and nothing wrong with his face. His speech wasn't slurred. I just basically asked him, like, what happened? He said that he had fallen. He was working on his garage. He had fallen. He doesn't know why he fell. But he fell and he was laying in the sun. And this was in July. So he fell in the sun on the concrete right outside his house, and they assumed it was a stroke because he's an older guy. Assumed it was hypoglycemia because he's a diabetic. Instead of just asking him what happened, basically he was laying in the sun until somebody found him. Those abrasions that he had on his leg were actually third-degree burns. Don't know why anybody didn't see that, but the telltale sign that it was not probably a stroke was the fact that the man's toes were blue. I mean blue. Blue. So I was pretty upset with my ER staff for not assessing him. I mean, as soon as he got to the unit, I saw his blue toes and knew something was catastrophically wrong with his leg. He couldn't move it, clearly. But I didn't think it was because of a stroke. So I felt for pulses, could not find them. Got my Doppler pulse, could not find a Doppler pulse. Could not find a Doppler pulse anywhere. So I called the vascular surgeon and explained to them what had happened. The patient had a burn to his leg. It was very, very swollen tissue. He was oozing serious fluid from that, so it very clearly was acting like a burn. He could not move the limb. There was no pulse to the limb whatsoever. And this is right at shift change. I mean, I worked night shift, so this was right before shift change. I didn't get a whole lot, but I had to really, really make my point to, hold on. I had to really, really make my point to that that vascular surgeon that this was an emergency, and this is 5 o'clock in the morning, and this patient is in dire straits here. The only thing he wasn't complaining of was a whole lot of pain, which most patients who have compartment syndrome are complaining of a lot of pain. So he was past that point. Apparently his nerves were actually shot too. So I say shot, that's not medical. They were impaired. They were not conducting impulses the way they should have been. Therefore, he was not sensing the pain. Okay, so we get the vascular surgeon involved. I call the hospitalist and get everybody involved that needs to be involved. And I come back the next day, and the nurse that I gave report to showed me pictures of this guy, of this guy's leg. They had taken him down to surgery, and they did fasciotomies. Basically, they cut down the medial aspect of his lower leg and on the lateral side of his leg to open up those compartments to give the muscles room so that we can get the nerve impulses working again, we can get the swelling down, we can allow blood flow to go back. They said that when they opened him up, the tissue was gray. Look gray like my shirt. I saw the pictures. I tried to look for them. I don't have them anymore, but gray tissue. Obviously, it's not viable muscle, but they were hoping they'd be able to save what they could from this patient's leg. Fast forward, the patient ended up getting an amputation of his foot, actually from the above the knee amputation, so it was his knee as well, if I remember correctly. But this patient lost his leg. Could we have maybe salvaged some of it if he didn't sit in the ER for, I don't know, 10 hours before he got to me? I think so. I think so. He may have had a foot if we had caught it sooner. But that's why it's important for you guys to get the story. You guys are the ones that are picking these patients up. These patients are able to talk before they're not able to talk. Get the story from them. If we would have known that it was a burn, we probably would have treated it differently. Probably would have went to the burn unit to be treated as a burn and not a stroke. So why couldn't he move his left side? Well, he ended up experiencing rhabdomyolysis. And so rhabdomyolysis, some of you have talked about this in your discussion board as well. And rhabdo is basically a breakdown of muscle, and it can be from anybody laying in the same spot for so long, but the muscle basically is being degraded, and it's releasing all of its contents, and it basically puts the patient in kidney failure. And so they develop this huge problem from the breakdown of muscle tissue. People who overwork out. I had a student of mine last semester actually put herself in a rhabdo because she was lifting too hard to manage stress. So those of you who lift, drink a lot of water. Take it easy. One more thought on fascia. My grandfather had some theories about fascia that he didn't call it fascia. He didn't even know what it was called. He's not a scholar. He's not an academic. He's not a doctor. And anyway, he is a first-generation Mexican-American who picks cotton. Dropped out in second grade. So he doesn't have a lot of education. But he had this theory that our fascia was related to illness. And he didn't call it fascia, he called them phlemones. I don't know what phlemones means. I don't know, he made it up. But he would take Vicks, obviously. Vicks cures everything, clearly. He would say the sane sane, and he would massage our muscles when we weren't feeling well until the phlemones went away. And so what the phlemones were if you ever take your hand and you rub it up and down your arm or your leg or any major muscle, and you feel that bumpiness underneath the skin, he would call those phlemones, and he would not stop rubbing the Vicks on there and rubbing them out until those bumps were gone. And so I don't think there's a link between, maybe there is, a link between the fascia and our immunity, but clearly there's a link between that and our overall general health. It's a working theory. He was onto the whole fascia massaging scene before it was cool.